Nobody tells you about the financial cost of being sick in Nigeria. Not really. They talk about the emotional toll, the physical burden, the isolation, but the money, the quiet, relentless, grinding financial cost of having a body that requires more than the system was built to give, that part mostly goes unspoken. So let me speak it. People think survival is the hard part. Sometimes the hard part is affording it. Because I have sat somewhere quiet, running numbers in my head that should never have needed running, weighing what my body needed against what was actually possible, and choosing and living with the choice, and smiling when someone asks how I was doing. This video is about that calculation and why nobody should have to make it. When people imagine the cost of illness, they think about hospital bills, medication, surgery, consultations, but that's just the visible part. The invisible price tag on chronic illness or rare disease in Nigeria includes things that never appear on any invoice. The transportation to facilities that are only in certain cities. The accommodation when those cities aren't yours. The days of work missed, if you have work that can be missed. The family members who take time off to become your caregiver without compensation or acknowledgement. The cost of being sick in Nigeria is never just the cost of treatment. It's the cost of reorganizing an entire life around a body that needs more than the infrastructure here provides. Let me tell you what one bad day costs. Not a crisis, just a bad day. A flare, a setback, a day where the body says absolutely not. Transportation to a facility because the one closest to you either doesn't have what you need or doesn't know what you have. A consultation fee for a doctor who will likely send you somewhere else. Medication that may or may not be available in the country. And if it isn't, the cost of sourcing it internationally, shipping it in, hoping it clears customs. Lost income for that day. Lost income for the person who came with you, because navigating the Nigerian medical system alone on a bad body day is its own kind of impossible. One bad day for someone with a chronic or rare condition in Nigeria can cost more than most people spend in an entire month. And then you go home and you do it again next time because there is no other option. The trade-offs are the part that stay with you, not the big dramatic ones, the quiet ones, the ones you make so regularly that they start to feel normal. Do I buy this medication or cover this bill? Do I attend this appointment or keep this commitment I can't afford to lose? Do I tell someone how bad it actually is or protect their peace at the cost of my own? These aren't rhetorical questions. They are actual decisions people with chronic illness make in this country every single week. And the toll of making them isn't just financial. It's the slow erosion of believing that your health is something you deserve to prioritize. This isn't entirely about individual poverty. It's about a system that was not designed with chronically ill or rare disease patients in mind. Health insurance in Nigeria, where it exists, rarely covers rare diseases. Specialist care is concentrated in a handful of cities. There is no national framework for rare disease patient support, which means every patient is essentially navigating alone, building their own system for whatever they can access and whatever they can afford. And when they can't afford it, which is often, the gap between what they need and what exists is paid for with time, with health, and sometimes with years. I'm not going to pretend there's a simple answer, but there are starting points. Rare disease needs to be named in national health policy, not as an afterthought, but as a category that requires specific, dedicated support. Health insurance frameworks needs to expand their definition of covered conditions. A condition doesn't become less real because fewer people have it, and there needs to be community support infrastructure, organizations, networks, resources for people navigating chronic illness in a system that wasn't built for them. This is not impossible. It requires awareness first, which is partly why I'm here, saying it out loud, because the things that aren't spoken are the easiest to ignore. And I am done being quiet about something this loud. I have made calculations I should never have had to make, and I know I'm not the only one. Your health is not a luxury. It was never supposed to be something you budget for against your survival. And until the system catches up, I just want you to know that the weight you are carrying is real. The cost is real, and it shouldn't be yours alone.